Instagram story yesterday, we had the votes for whether or not you'd want to see dry needling or some soft tissue treatment for lateral ankle sprains. Lucky for Dr. Crafty, you guys chose dry needling. So I'm going to show some ways that I utilize dry needling when it comes to treating the lateral ankle sprain. So when I talked about the different taping techniques and talked about how we could use certain types of tape to help with the inflammation initially, prior to doing that, a lot of times I like to do some needling to try to promote even more blood flow through the area and hopefully allow some more of the movement of that excess fluid out of the ankle and back up into the lymphatic system. So the way that I do this typically, like I tell people, if I could needle an ankle as the person's walking off the field after they sprain it, I would do it as soon as I can. Obviously, that's not really a doable thing, so we'll do it here in the office. For this application of needling, I use a lot of these 1/2 inch, the shortest needles we have, and I just kind of bombard the area with needles, so we do a good amount of them. So as we go through, and these won't go too deep, we've talked about needling in other videos, but all that it is a small monofilament needle, not a hypodermic one like you would get a vaccine or shot with. These are just small needles that just a little tap, put it in a little bit, and that's it. Might feel a pinch as you do it, but that's about it. Yep. And then now we'll do the fast forwarding part. That's an editing later. Okay, so I pulled up a little short there. I would typically do a lot more in this, and I would let these cook for 30 minutes. Typically, we would just kind of let them hang out here with these needles, and then we would pull them. Something else I may do with, outside of this specific kind of needling for inflammation, I may also look for trigger points. So we could combine that with, a lot of the times we'll find some up in the calf. So let's say he's got one here. Same thing on the skin, tap. And for Ben's sake, I'll keep it a little bit more superficial because he's being a good model. And let's say I have one here as well. So that's about it with the dry needling. I think a lot of times people have preconceived notions of how it could be a little scary, it could be a little painful. You can see that Ben's doing a really good job here, but it's a very, I'm not going to go as far as saying comfortable treatment, but it's not as bad as people may think it may be. So dry needling can be a very powerful tool for helping with the initial inflammation and restoring some of the soft tissue around the lower leg back to